Hi, I'm Dr. Elizabeth Markle with Open Source Wellness, and this really short video is designed to give you a quick introduction to who we are, our mission, vision, and work in the world. So, our impact really spans health, equity, human connection and loneliness, workforce development, and systems transformation at scale. And to give you an introduction to all that, I want to take you back to where we began. So, my co-founder and I are both psychologists. I'm also a professor of community mental health. And when we had the idea to found Open Source Wellness back in 2016, we were both really interested in what we now call behavioral prescriptions. And this is anytime a doctor or a mental health professional gives advice to a patient that might sound like, you need to exercise more, or you need to eat differently, or you need to reduce your stress or get some meaningful social support in your life. Now, the way we understand it, these are really good advice. There's nothing wrong with these. The problem is that they're often verbally delivered, followed by something that sounds like, alrighty then, good luck with that. I'll see you in 6 months. Take care now. And as we understood it, there are several problems with this. First of all, this was a prescription with no pharmacy. There's no delivery system in the country for this kind of prescription. And second, there's an equity problem because our patients who have the financial and socioeconomic privilege might get these prescriptions and hire themselves a private health and wellness coach or start shopping at Whole Foods or join a Pilates gym. And for those patients who didn't have that kind of privilege, this was a prescription to nowhere. In fact, we understand it as a prescription for a reliable feeling of shame or personal failure when folks very predictably struggle to enact these in their lives. So, in 2016, we co-founded Open Source Wellness with the mission to generate community as medicine, partnering with communities in healthcare to deliver joyful, trauma-informed, and culturally relevant programs for health, well-being, and human connection. And this icon here, these four little graphics, represent our universal prescription, which we like to abbreviate move, nourish, connect, and be. And over what is now 9 years of development and iteration, we understand this community as medicine model as an experiential, equity-centered, trauma-informed, and joyful approach to group health and wellness coaching. And that experiential word is really important because our belief is that talking about health and well-being is good, but actually doing these practices together is even better. So if you visit a community as medicine group, whether it's happening in person or virtually, in a community space, in a federally qualified health center, in English or Spanish or Cantonese or another language, what you'll see is human beings actually practicing these four pillars of human well-being together. Every community as medicine group moves through an arc of activities that includes movement and mindfulness, a little education, and small group health and wellness coaching. There are a couple aspects of this model that I think make it unique. I spoke about it being experiential. It's transdiagnostic, meaning that we don't have groups for people with depression or groups for people with diabetes. We have groups for human beings because all of us have both strengths and challenges that we're working with in our well-being. Every aspect of the model is designed to be trauma-informed, to be culturally affirmative and adapted to meet the needs of unique populations, scalable and affordable, and I'll share more about how we're doing that. And lastly, joyful. And something I want to say, having worked in the mental health field for a long time, is that often, particularly mental health care, is shrouded in realms of fear and shame and isolation and anonymity. And we really understand that we have the capacity to support human beings, not with these sort of dark clouds of avoidance and distress, but with welcome, belonging, vitality, vulnerability, empowerment, and inclusion. Last thing I want to say about the model is that anybody who's worked in healthcare or in social services knows how deeply siloed physical health, chronic disease, behavioral health, social health can be. And with this model, we have really made a deep commitment to integration, that the community as medicine actually lives at the intersection of physical health, mental health, and social health. We've been delivering this work since 2016 in partnership with all kinds of different clinical, community, payer, food as medicine, YMCA organizations. And we've really developed this model with a patient population that is profoundly diverse in terms of demographics and in terms of life experience. My co-founder, Dr. Ben Emmer Aronson, is a statistician, and he has made sure that we have been tracking our outcomes data all along. So we're looking here first at mental health outcomes. This is a sample of about 240 FQHC patients, and we're seeing just dramatic drops in depression, anxiety, and loneliness. This is about 750 of our FQHC patients that are seeing significant increases in daily intake of fruits and vegetables and physical activity. For a hypertensive subset of our participants, we're seeing dramatic drops in systolic blood pressure. And in particular, the data that gets the attention of our payer partners is that we're seeing significant, this is about a 77% drop in emergency department visits and unplanned hospitalizations. So our work currently occurs in three main streams. First of all, we provide direct services. We deliver this community as medicine model in partnership with clinics, payers, community-based organizations, and others. And really our mission in this direct services work is to make it as easy as possible for clinical and community organizations that are already overstretched. So we really handle as much as possible to make this easy for them. The second arm of our work that's really leading the pathway to scale is what we call the Community as Medicine Learning Collaborative. And this is where we work with organizations who want to build the internal capacity to deliver this model themselves. Our participating organizations include 7 YMCAs around the country. We're getting really tremendous uptake and engagement from YMCAs, and we're also working with other clinical and community organizations. And this work involves not just training them to deliver a model, but helping them build the local partnerships between clinics and communities and payers such that this is a really sustainable contribution to the health and well-being ecosystem. Finally, we provide health and wellness coach training. We provide significant scholarship funding that's supported by Philanthropy, and we've really built this program to focus on cultural humility, trauma-informed coaching, and group coaching, in addition to all the other competencies. And as a mental health professional, I see this health and wellness coach identity as a really essential new piece of the mental health sort of services pantheon, that while community health workers and peers bring incredible levels of support, health coaches actually have significantly more training and skills evaluation and practice, but it's far less expensive and time-consuming to train health and wellness coaches than it is to train, say, a psychotherapist or a social worker. So we're really working to build the diversity and the strength of this professional identification. To share just a tiny bit about our funding, our annual budget is about 1.4 million. We're actually about 60% earned revenue in our direct services and our training. About the 40% that makes up Philanthropy. We named a couple of our major funders here. This is not an exclusive list, but we've been so profoundly supported by some of these lead funders. Our current funding needs, number one, is around building capacity and infrastructure to spread and scale this community as medicine model via the Learning Collaborative. For an organization to shift from being predominantly direct services to being significantly a training and licensing organization, it's a really exciting and big growth opportunity for us, and we're looking for the right philanthropic partners to help us do that. We're always looking for support, as I said, to provide educational and employment opportunities and training for the next generation of diverse allied healthcare workers. And we're always looking for support to expand and sustain our direct services work. So I think of this short video as just an invitation to a conversation about how we might partner to amplify our shared vision and mission. So I want to invite you to please reach out. My email is here. It's liz@opensourcewellness.org. I would really look forward to a conversation with you. And thanks for taking the time to get to know us. Be well.